What is your first name? What is your middle name or initial? What is your last name? What is your date of birth? What is your gender? Male, male, female, transgendered, male. What is your current marital status? Married, divorced, separated, single, widowed, married. What is your ethnic group? White, black, Asian, Hispanic, Native American, Pacific Islander, other. White. What type of transportation do you use to get to the doctor, to the store or to other places you need to go? Check all that apply. Drive self. Driven by others. Bus taxi. Other. I don't have any means of transportation. Drive self. Driven by others. What, if any, assistance do you need to walk? I can walk without assistance. I use a walker. I use a cane. I need someone to assist me when I walk. I need a wheelchair. I am bedridden. I can walk without assistance. Are you able to remember to take your medication on your own? What, if any, assistance do you need? I use a walker. Do you have the equipment you need to help you walk? Cane, walker, other. Yes. Yes. Is the equipment, cane, walker, other, functional? Yes. Yes. Are you able to remember to take your medication on your own? I do not have any prescribed medicines. I remember to take my medication on my own. I remember to take my medication on my own. Can you prepare your own meals? I never need help. I sometimes need help. I always need help. I sometimes need help. Do you need help eating? I never need help. I sometimes need. I never need help. Do you need help with bathing? I never need help. I sometimes need help. I always need help. I never need help. Do you need help with toileting? I never need help. I sometimes need help. I always need help. I never need help. Please select the statement that best describes your use of caregivers to help you with daily living tasks. I do not need a caregiver. I need a caregiver, but I do not have one. I have a caregiver. I do not need a caregiver. In the past 4 weeks, how often have you had difficulty with holding your bladder? Incontinence? Never. Sometimes. Frequently. Always. Never. Are you afraid of falling? Never. Sometimes. Frequently. Always. Never. Have you fallen in the last 12 months? Yes. No. No. In the past 4 weeks, how often? Never. How often do you exercise each week? I do not exercise. 1 to 2 times a week. 1 to 2 times a week. For how long do you typically exercise? Less than 20 to 60 minutes. What types of things do you do for exercise? Walk. In the last month, did you ever eat less than you felt you should because there wasn't enough money for food? No. 1 or 2 times. Please describe your current living situation. Please check. I live in a home apartment. Have you been in the hospital in the last 6 months? Yes. No. Do you have any pain or hurting anywhere now? Yes. Yes. Have you had any pain or hurting in the last 5 days? Yes. Yes. When you have pain, where is it? Check all. Neck. Back. Please describe the pain in your back. Check all that apply. Aching. Burning. Throbbing. Aching. How would you rate the intensity for 3? Please describe the pain in your neck. Check all that apply. Aching. throbbing, crushing. How would you rate the 5, severe? How does your pain affect your everyday life? Sleep, ability to bathe, groom, dress self, interaction with people, daily activities, concentration. Are you currently taking medication for your pain? Yes. Have you ever had an amputation? Yes. No. Have you ever had or been diagnosed with asthma? Yes. No. No. Have you ever had or been diagnosed? No. Has a health professional ever No. Have you ever had or been diagnosed? No. Do you have diabetes? Yes. Have you been treated for gastrointestinal? No. Have you ever had or been diagnosed with glaucoma? Yes. No. No. Have you ever had or been diagnosed with diabetic retinopathy, eye problems due to diabetes? Yes. No. Have you ever had or been diagnosed with other eye problems? Have you ever had or been diagnosed? Yes. Have you ever had or been diagnosed with high blood pressure or hypertension? Yes. Has a health professional ever told? No. Have you ever had a heart attack? Yes. No. No. Have you ever had or been diagnosed with neuropathy? Yes. Have you ever had or been? No. Have you ever had a bone fracture? Yes. No. No. Have you ever had or been diagnosed with kidney disease? Yes. No. No. Have you ever received hemodialysis or kidney dialysis? Yes. No. No. Have you ever had or been diagnosed? No. Have you had significant changes in your weight? No. Have you ever had a seizure or No. Have you had any skin problems such as ulcers or sores on your skin or derm? No. Have you ever had a stroke? Yes. No. Have you ever had surgery? Yes. What type of surgery or surgeries? When was your most recent surgery? 1 to 2 years ago. Have you ever had or been diagnosed with thyroid problems? Yes. No. Have you ever had a transplant? None. Have you ever had a blood No. Have you ever had or been diagnosed with No. Have you ever had or been diagnosed with peripheral No. During the past 4 weeks, how much of the time did you feel short of breath? Some of the time. Do you ever cough up any stuff, such as mucus or phlegm? No, never. Only with occasional colds or chest infections. Yes, a few days a month. Yes, most days a week. Yes, every day. Yes, a few days. Please select the answer that best describes you in the past 12 months. I do less than I used to because of my breathing problems. Strongly disagree. Disagree. Unsure. Agree. Strongly agree. Unsure. Have you smoked at least 100 cigarettes in your entire life? No. Yes. Don't know. Yes. How old are you? Age 35 to 49. Age 50 to 59. Age 60 to 69. Age 70 plus. Age 50 to 50. Have you ever been diagnosed with depression? Yes. No. Yes. Over the last 2 weeks, how often have you been bothered by having little interest or pleasure in doing things? Not at all. Several days. Over the last 2 weeks, how often have you? Several days. Over the last 2 weeks,